Welcome back to Fox 17 Morning Mix. Are you missing multiple teeth? Do you have trouble eating or speaking because of loose-fitting dentures? Today we welcome back the team from Transformation Dental to talk to us about a life-changing procedure that will help those that are missing their teeth regain their smile and their confidence. I'd like to welcome back Dr. Peabody, Dr. Jesin, and Megan. Thank you so much for being here with us again.
Thank you.
Yes. And we've been talking about this for a couple of weeks, but for those people who are just now tuning in, let's talk about what is the all-on-4 approach that you guys take.
Well, thank you, Leanne, for having us today. Our goal in coming here over the past several weeks has been to educate the West Michigan community about the options that are out there when they're missing their teeth. Most people think that their only option that's there when they're at the end of the line with their teeth is a removable set of dentures.
Right.
And that simply is just not true. With the novel technology that we have today, like the all-on-4, we're able to place 4 precisely placed implants into the jawbone and provide the patient with a set of non-removable teeth that they can actually function and chew on that very same day.
Right.
And the reason we're able to accomplish this is by working with a team that includes surgeons, a prosthetic specialist is Dr. Peabody, a dental lab technician, that are all working in one center.
Great. And Megan, you are the treatment coordinator.
Yeah.
What exactly is it that you do?
You know, I like to consider myself the hand holder for the patient. Many of these folks haven't been to a dentist in years, and they're nervous and they're scared, and I'm just kind of that contact person for them, from the initial phone call to the consultation to day of surgery. I'm there with them. So just being that familiar face and that familiar voice and making the process as simple as possible for them. That's what I'm there for.
Sure. I'm sure you hear all kinds of stories why these people are in the situation they are, whether it's an accident, whether it's just something that's happened over time, you name it. There's a little bit of everything that goes on. So who is a great candidate for this procedure?
So we found that almost anybody who is struggling with their current oral condition is a candidate for this procedure. Whether it's a patient struggling with their teeth that are hurting them or that are breaking down, or a patient struggling with dentures that they're wearing, or that they don't have teeth at all.
Sure.
We've actually had patients come to our office who've been to 3 or 4 previous dentists who've told them that they don't have enough bone for implants. And in order to get implants, they would have to build up their bone with extensive, painful grafting procedures that can take months in order to heal.
Yeah.
And with the technology that we have today, such as the all-in-4, we're able to place them in key positions of the jaw that already has bone, so they don't need to go through that bone grafting procedure. And almost every patient is a candidate to have it in a same-day procedure like that without any bone grafting. So we welcome people to come for a complimentary consultation so we can see and evaluate them in the office.
I love the whole same day of all of this. I mean, as someone who's been through this before, I know there were a couple days where I had to wear some temporary ones and I couldn't eat certain things, and your confidence is already kind of down as it is, so you want your spirits lifted back up with that beautiful smile once again. And once you regain that smile, it's a life changer. And I know you hear these stories all the time. If you want to talk about some of these people that have come through your doors and walked out a whole new person.
Yes, the one thing that we notice all the time is that, like you mentioned, confidence is down. People have lost hope, and I have tons of stories, but one that sticks out is one from a close colleague of mine who talked about a case that he did, and usually we have like a 1-week follow-up visit after the surgery, and on that follow-up visit, this mother brings her child in and introduces her to my colleague, the dentist, and she said, "This is the doctor that helped mommy get her smile back," and the child just goes and runs and hugs the doctor. And he says, what's going on? He said, you know, mommy loves me again.
Aww.
And it's things like that. Patients tend to retract, tend to close down. They shut out people that love them, that care for them, and no one knows why. And when you have an embarrassing smile, a smile that you don't feel confident about, that's typically what happens. So we're hoping to bring hope to this community here, and so that people don't have to shy away from their family members, their friends, and have people think that, you know, they don't care about them anymore.
Yeah, I love that, because they didn't love themselves. So like you said, it was hard for her to try to, she loved her child, I'm sure she did, but the child just wasn't feeling it because mom wasn't feeling themselves. All right.
Wasn't smiling or anything.
Yeah, I love that. So we need to make sure that people reach out to you, and we need to talk about the best way for them to do so, to get in to do this consultation. So there's a way that they can get a complimentary consultation with you guys?
Absolutely, yeah. They can call our office, 616-361-7327, or visit the website, ngsmiles.com. They'll talk to me or anybody that answers the phone, really, and I'll be more than happy to set up an appointment with them and and just help them out.
Yeah, and up there on the screen right now, we have a great look at your team that makes this all happen. And we've seen many of them here on the show, so I feel like I kind of know you guys already. So yeah, keep up the great work. And as you mentioned, make sure to go to ngsmiles.com so you can reach out to them and get that smile back, especially for the holidays. That would be nice to have. All right, thanks so much for stopping
Leanne.
by.
Thank you.